everyone. So, I'm going to administer oxygen administration via nasal cannula. So, first and foremost, I want to introduce myself. My name is Angel Kate Go, student nurse from Davao Doctors College, taking Bachelor of Science in Nursing, which is from Section 13D. So, today I am going to administer oxygen therapy via nasal cannula. So, oxygen administration is a therapy to maintain adequate tissue oxygenation while minimizing the cardiopulmonary work. So, uh, there are certain medical problems that can cause low blood low blood oxygen in your body. So, if you have low blood oxygenation or low blood oxygen in your body, it can create or it can lead to any issues or problems. For example, hypoxia, you have this tachycardia, restlessness, dyspnea. We also have confusion and cyanosis. So I'm going to administer it for in my patient. So first procedure is we need to determine the need of oxygen therapy and verifies the order of the therapy. Why? Because verifying and knowing giving oxygen therapy will prevent from any medical record. So you're going to look at for the doctor's order or your yellow chart or chart for the order of the doctor for administering any therapy for our client. So for the doctor's order, we have here in the room 203, which is our patient name is Melanie Go, 36 years old, and for the doctor's order is here. Administer oxygen therapy, oxygen via nasal cannula. So we determine what therapy we're going to give for our patient. For our next procedure is we're going to uh, perform respiratory assessment to develop baseline data if not already available. But if you already take respiratory assessment ahead of time or before the doctor's order for oxygen administration, you don't need to redo it because you already have your baseline data. Take note that giving respiratory assessment, you should look for the hands of or the capillary of the patient or the hands of the patient, or if there are any signs of cyanosis or the general cyanosis or in the peripheral cyanosis, because it is one of the symptoms of low blood oxygenation in our body. Next is we're going to prepare our client and as well as their supporting people in a or family. So first is we're going to assist or position our client in a semi or high Fowler or semi Fowler position, because semi Fowler or high Fowler position can promote lung expansion, which can help our client breathe easily. So ma'am, ingana pa posisyon ti kaging ani ma'am ha, para makatarong kag hinga. Okay lang? Okay, thank you. Next is we're going to explain to our client that oxygen is not dangerous when safety precaution was observed, because there are some instances that our client or our patient are anxious because they think that oxygen will burn their lungs, which is not. So we're just going to ensure them that there are no any hazard or bad side effect of having oxygen therapy. And so ma'am, maghatag lang ko og oxygen administration sa imuha. So kaning oxygen nato ma'am, dili na siya makadaot sa tuang ano ma'am, ato ang lungs, which is okay lang na siya kay mas makatabang man na siya og hinga sa imuha, mas makahinga ka og tarong. Next procedure is we're going to explain to our client, we're going to inform our client as well as their supporting people the safety precaution of the connected oxygen use, because there are instances that uh, the mostly the supporting people or the watcher are adjusting the level of the oxygen, which is a no-no. So we're going to explain the things that na hindi pwedeng galawin yung oxygen tank. Kailangan ang makakagalaw lang nito, which is ang nurse or ang doctor na na-assign sa ating patient. And also, we're going to inform that there's no smoking in this area. Dapat bawal ang sigarilyo. Sapagkat ang oxygen tank or ang oxygen is flammable, which is maaring magkaroon ng sunog if may mga malalapit na apoy, kaya bawal manigarilyo sa loob ng area na may oxygen tank or kung saan dito sa hospital. So, i-inform natin sa kanila na bawal ito, bawal galawin yung oxygen tank, bawal manigarilyo sa loob ng establishment na kung saan may mga oxygen tank kasi maaaring itong magkaroon ng mga apoy. So, prior to performing the procedure, introduces yourself and verifies your client identity using the agency protocol. It is to ensure that you are in the right client, right patient, and right patient to administer the therapy that the doctors order. And also, introducing yourself can create rapport to the patient or assurance that you are the nurse or the assigned student nurse or nurse that they can assure will help them. So, mayong buntag di ay ma'am, ako dahil si Angel Kate Go. Gikan di ko sa Davao Doctors College, student nurse din mo karon. So, ma'am, ano di ay, pwede na ako makita ng mga wristband? Melanie Go. Okay. Ma'am, pwede niyo mo i-state mo ang full name? Okay. Yung mga birthday, ma'am, pwede niyo mo maingon? Okay. Thank you po. Next is we're going to explain what we are going to do and why is it necessary and how he or she can participate to our procedure. Because explaining it to our client will give them assurance as well as they can also participate because they already know what are the things or the procedure we're going to do. So, ma'am, karon day ma'am, maghatag day ko nimo og oxygen therapy, which is ato ang anuhon sa gikan sa imong ilong ma'am, diri ani nasal kanula. So kani siya ma'am, ang buhaton ako ani ma'am, magtaod ko sa imong og oxygen ma'am aron makaginhawa kag tarong. Kay nakita mo nato ma'am na imong oxygen level kanang baba kaayo sa akong pagtan-aw nako kaganina. So kinahanglan nato magtaod og oxygen sa imuha kay aron makaginhawa kag tarong ug ma-normalize ang oxygen or ang oxygen flow sa imong lawas. Para wala na kay laing pamation, wala na kay sakit. Okay lang ba? Salamat! Next is we're going to discuss how the effects of oxygen therapy will be used in planning further care or treatment in our patient. It is to make our client or patient know that oxygen therapy is a need for them for their further treatment or assessment or care. So, ma'am, according iano ma'am is ang oxygen ma'am, oxygen therapy ma'am, kinahanglan po nato ni siya kay aron kanang if ever man na ay mga buhaton sa imong og another buhaton or kanang mga treatment pa sa imong buhaton, naatay ka ng mas makatabang siya sa imuha. Next is we're going to perform hand hygiene and observe other appropriate infection prevention procedure. For example, by using antiseptic in our hands or by putting alcohol or by performing our hand washing. So now I'm going to put alcohol, or you can also perform hand washing. But it will take time if you're going to perform hand washing. So you can use alcohol or any antiseptic. Next, for that is we're going to provide our clients privacy para hindi naman siya ano ng ibang hindi siya madedestorbo, hindi makikita kung anong mga procedure na ginagawa sa kanya, kaya kailangan natin i-provide yung client natin ng privacy. So, you can close the door or close the curtain if necessary, kung gusto naman ng patient ng privacy. Pero kasi may mga ibang patient na ayaw nilang isarado yung mga pintuan, yung mga ah, yung kung nasa cubicle kayo, yung curtain ayaw nila. So, you can close them or not if the patient is want to close it or not. Next is we're going to set up the oxygen uh, equipment, or we're going to prepare or set up the oxygen equipment and the humidifier. So, first is we're going to attach our flow meter to the wall outlet or our tank. Mostly ngayon, I can see in some hospitals here in our city, Davao City, is mostly sa kanila is mga wall outlet na. Hindi na kagaya ng mga tank or oxygen tank kasi it is uh, mas mabuti ito kasi hindi na siya magagalaw ng iba, hindi na siya matutumba. So, mas less yung risk na matutumba or maaano yung pasyente natin. Makakapekto or madidisgrasya, I mean. And, flow meter should be off position. Kasi, kailangan siyang off position pag i-attach na natin siya sa ating oxygen tank or sa ating wall outlet, sapagkat para hindi siya masayang hindi pa siya, paglagay natin, yung oxygen, hindi agad lalabas or masayang yung oxygen. Next is we're going to fill the humidifier bottle if needed. Pero kung may laman pa yung humidifier bottle natin, marami pa, no need to fill it again. So, in filling the humidifier bottle, kailangan it should be done before coming to the bedside of the patient. So, assuming na na-fill ko na siya or okay na yung may laman na yung humidifier bottle ko, so no need for me to fill it again. Next is we're going to attach our humidifier bottle in to the base of our flow meter dito. Kung makikita mo, kasi picture lang ito, so assuming malaki ito, tapos nandito yung oxygen tank, tapos nandito yung flow meter, sa baba mo siya i-attach sa base ng flow meter, makikita mo doon. Doon mo i-attach yung humidifier bottle. Ang humidifier bottle, ang purpose ng humidifier bottle, alam naman natin na ang oxygen is mainit. So, ang humidifier bottle, yung oxygen, mag-pass through dun sa humidifier bottle, magko-cool down yung oxygen. Para pagbigay natin ng oxygen sa ating patient, hindi na siya mainit. Kaya may mga patient sabihin natin na oxygen is mainit, nakaka-burn ng lungs. Hindi. Kung may humidifier bottle. Next for this is we're going to attach the prescribed oxygen tubing and deliver the device to the humidifier bottle, which is this is our uh, oxygen tubing. So, kailangan sakto yung oxygen tubing na ibibigay natin sa ating patient because kapag binigay mo is not adult tubing, yung hindi pang adult na oxygen tube or nasal cannula, is hindi makakaginhawa or hindi mabibigyan ng exact or adequate oxygenation yung patient natin. Hindi sakto. So, ito yung yung nasal cannula or oxygen tubing, ilalagay ko sa aking patient. It is for adult. So, assuming na iti-tape ko siya dito ang delivery device sa ating humidifier. So, assuming na Ito yung ating oxygen tank, yung humidifier bottle. Ipipaste ko siya dito.
せーのでもそんなんじゃダメもうそんなんじゃほら心は進化するよもっともっと 言葉にすれば消えちゃう関係なら言葉を消せばいいなって思ってた恐れてただけどあれなんか違うかも千人の道も一歩から石のように硬いそんな石で塵も積もれば大和なでしこ
So, tubing na na-paste ko na. Ito na. Ito na yung tubing natin, oxygen tubing na-attach ko na siya dito sa ating humidifier bottle. Next is we're going to turn on our oxygen at the prescribed rate and ensure the proper functioning of it. This one, we're going to turn it on. And we're going to ensure its proper functioning because there are instances na hindi gumagana yung ating oxygen tank or oxygen wall outlet. Next is we're going to check the oxygen if it flow freely on the tubing. So kailangan natin malaman kung kasi may mga instance din na hindi siya nagfo-flow freely kasi natutupi yung tube. So kailangan natin siya na-check. Ito. Ayan, ito. Okay. Okay siya. Next step for that is we're going to set the oxygen at the flow rate ordered. Kasi hindi naman natin pwedeng magsiset tayo ng hindi ordered ng doctor. Anong mangyayari ng patient natin? Pwede siyang masobrahan ng oxygen or di kaya makulangan. So for our next procedure is the application of the appropriate oxygen delivery device. So for the application of the ODD is first we're going to put the cannula over the client's face with the outlet prong fitting into the nares and the tubing hook over
言葉にすれば消えちゃう関係なら言葉を消せばいいなって思ってた恐れてただけどあれなんか違うかも千人の道も一歩から石のように硬いそんな石で塵も積もれば大和なでしこ芯抜きでいや死ぬ気でふわふわりふわふわるあなたが名前を呼ぶそれだけで宙へ浮かぶふわふわるふわふわりあなたが笑っているそれだけで笑顔になる神様ありがとう運命のいたずらでも巡り
this one. And after that is we're going but if the cannula will not stay in place, we're going to tape the side of the face of our patient so that it will not move. But sa mga patient naman, mostly kapag totoong patient natin, hindi talaga mag-move yung cannula sa cheek ng ating patient. Kasi didikit lang siya. But our patient now is a staph toys which is mag-move talaga siya kasi hindi siya didikit. So, pwede natin siyang lagyan ng tape. Mostly naman din, lalagyan natin ng tape, lalo na yung mga bata. Kasi malikot yung mga bata, kaya pwede natin lagyan ng tape.
会えたことが幸せなのでもそんなんじゃダメもうそんなんじゃほら心は進化するよもっとも
For the next one is we're going to pad the tubing and band over the ears and the cheekbone of the patient as needed. Like this. So, sa pagpad naman, hindi naman siya required or kumbaga, hindi naman siya kailangan lalo na kung stable naman yung pagkakalagay ng ating cannula o yung tubing dito sa ating ears tsaka dito sa ating cheekbone. Then, after that is, the next is we're done with the application of our cannula we're going to move for the assessment for our client. So in assessing our client, first is we're going to assess our client's vital signs, the level of the anxiety, as well as the color, the ease of the respiration, as well as we're going to provide support while the client is adjusting to the device, especially to those clients na mga first timer na oxygen therapy. So, kailangan natin sila provide ng support na okay lang to. Kailangan natin sila i-approach. Kailangan natin sila i-question, mga tanungin kung okay lang ba, ano bang nafe-feel nila, mga ganon. Tsaka, kailangan natin din kunin yung vital signs para malaman natin, para ma-base data tayo sa paglagay natin ng cannula ng oxygen sa ating patient. So, ma'am, okay lang ba ang atong paghinga, pagbutang na ako? Walay lain. Okay lang siya. Also, in vital signs, you can use also pulse oximeter because meron na siyang level of oxygenation as well as the heart rate of the patient. Gaya nito. For the level of the oxygenation naman, ang normal level ng oxygenation is around 95 to 100. Sa paggamit naman ng pulse oximeter, kagaya nito, you're just going to push this one, and then you're going to put your finger here, or the finger of your client, and then babasa na siya kung ilan yung oxygen level tsaka heart rate ng patient na dito na nakalagay. After that is we're going to assess for the client in 15 to 30 minutes depending on the condition of the client. So, kung mas komplikado yung condition ng ating client, so, maaaring nasa 15 minutes kailangan natin siyang i-check. Next is we're going to assess client regularly on clinical signs of hypoxia, tachycardia, confusion, also for the dyspnea, restlessness, and cyanosis. Why? Because those clinical signs are signs na kulang pa rin yung oxygenation sa katawan ng ating patient. Next is we're going to review for the oxygen saturation and the ABG result or the arterial blood gas result if available. Kung available naman yung result ng oxygen saturation tsaka yung ABG ng patient, pwede natin siyang i-review. No, kung ano yung mga baseline, pwede natin pagkuhanan ng mga base, yung oxygen saturation ng patient, yung mga ABG result ng patient sa pag-assess mo sa client or sa patient mo. Next step is we're going to assess the assessment of our nasal cannula. In assessing for the nasal cannula of your client is first you're going to assess your client's nares if there are any incrustation or irritation, because there are instances na yung mga client natin, lalo na yung mga hindi naglilinis ng kanilang nares or ng kanilang nostrils, meron yung mga incrustation. May mga may mga nagbabara, kaya hindi nakakapasok ng mabuti yung oxygen sa lungs ng ating patient. So, kailangan mo siyang i-check, kailangan mo siyang i-assess kung meron ba. And if ever, kung may mga incrustation, you can apply water-soluble lubricant to smooth the mucous membrane para masmoothen siya, matangtang siya, mawala siya, makahinga ng mabuti yung patient natin. After those assessment is we're going to assess the top of the client's ears if there are any signs of irritation regarding sa paglagay natin ng cannula tubing. Pero if present yung irritation or lalo na yung mga redness and rashes sa top ng ears ng ating patient, you can pad gauze pad to help relieve the discomfort of the irritation or the rashes of the patient. Ay, gaya nito, titignan natin, ask tayo ng question sa ating patient na, ma'am, may masakit ba dito or may makati ba? Pwede ko bang tignan? Kung may mga pula-pula ba? Ma'am, kung may pula-pula, pwede nating lagyan ng gauze pad para mawala yung sakit o yung kate. Kagaya ng patient ko, wala naman siya mga irritation, signs of irritations na aking nakikita. So, there's no need to put a gauze pad over the top of the ears of our patient. Next one is inspect for the equipment on a regular basis. In inspecting the equipment on a regular basis, first is we're going to check the flow meter and the level of water in the humidifier in 30 minutes and whenever you are providing care to the client. Why? Because there are instances na yung mga flow meter ng oxygen natin is nababago or di kaya hindi natin namamalayan na nagagalaw ng patient or di kaya ng mga watchers or ng family ng patient, lalo na yung mga naku-curious, kailangan natin siyang i-check para malaman natin na sakto lang yung binibigay natin na oxygen, hindi kulang, hindi sobra, sakto lang. Also, yung humidifier naman, yung water sa humidifier, kailangan talaga natin siyang i-check. Kasi, baka ubos na yung water dun sa bottle humidifier natin. Kaya, kapag yung oxygen na lalabas, mainit na siya sa patient. Mainit na paghinga sa patient. Kaya, kailangan natin siyang i-check always, regularly, in every 30 minutes or whenever you're providing care, yung water humidifier natin na kailangan natin siyang lagyan ulit ng tubig para mag-lessen yung init na binibigay ng ating oxygen dun sa ating patient. Kaya binubuga niya is cold air na siya or hindi ganun kainit. After that is we're going to make sure that the safety precaution was followed by asking questions to the client na finalo ba nila yon or wala ba silang nilabag doon sa mga sinabi ko kanina na for example, bawal manigarilyo sa loob ng establishment na mga patient na establishment na ito, tsaka bawal ang mga yung mga pagsindi ng mga posporo or mga bagay na may apoy, tsaka kung ano-ano, tsaka yung especially dun sa mga paggalaw ng ating wall outlet or di kaya ng ating oxygen tank. Also, after that, after asking questions, after making sure that the safety precaution was followed, you're going to perform hand hygiene or hand washing. You can use alcohol in hand hygiene or you can do hand washing. And do aftercare, you can clean your places, you can clean the bedside of the patient, yung sa mga bagay na ginamit mo. After that is after doing do aftercare is we're going to document findings of the client record using the form or the checklist supported by your narrative notes when appropriate. It is really necessary na kailangan natin i-document yung mga findings, lalo na yung if may napapansin kayo sa patient during your assessments na may mga pagbabago or di kaya yung level of oxygenation ng patient, pwede mo yung ilagay. Also, your vital signs ng patient, also yung mga yung assessment na ginawa mo if may mga clinical signs kabang napapansin gaya ng hypoxia, cyanosis, lalo na yung dito sa may kamay or dito sa may bibig ng patient, if bluish pa rin siya, pwede mo yung ilagay sa notes mo para i-transfer mo siya doon sa form or checklist ng ating patient. After doing that, we can thank the patient especially by cooperating, lalo na yung hindi nila paglabag sa mga safety precaution, especially yon, tsaka yung pag-cooperate, pagsunod lang sa mga sinasabi ng nurse kung ano ang gagawin. Pwede na yon. So, ma'am, thank you kaayo sa cooperate sa ato ang karon procedure karon sa pagtaod na ako sa imong sa nasal cannula, sa imong oxygen therapy. So, magbalik-balik na ko diri ama, mag-check lang ko sa imo ha. Check ko sa imo sa imong oxygen level. So, ayo lang kay kabalaka. If ever man lang ganina kay gapamatian, pwede ko nimo matawag, pwede nimo maingon sa nurse, pwede nimo maingon sa kuha, kung unsa ba imong gapamatian. So, that's all for our oxygen administration via nasal cannula, and hope you like it, and thank you for watching. Again, my name is Angel Kitgo from 13D, and thank you.
進化するよもっと